What ends up happening diagnostically, and this is where things start to kind of the rubber meets the road. If your kitty goes to the vet, first of all, ideally your vet is not saying that it's normal for a cat to vomit, because it is absolutely not, or potentially getting kind of like roped down the road that sometimes the clients will say that we think that it's mostly hairball, or it's happening due to stress, or they're eating way too fast, or all of these things that are not the cause. So hopefully that doesn't happen, and if that is recognized as a real problem and the client is willing to proceed with an evidence-based workup, which is ideal in this situation because we have really high stakes here, we are going down a diagnostic path and starting to do some tests. And we basically work as a funnel in this situation. So we do the tests at the very beginning that are going to give us the most information about the most organ systems and rule out the most amount of diseases possible. After we get past that, we're going to go to the next step that's going to further refine down. The end result ends up being that we do a test that's very specific for things. So first step is general lab work. We may take an x-ray if we thought that there was a foreign object or something like that, but usually, again, this is a chronic vomiting talk. These kitties have had this going on for typically months or years by the time we're actually being made aware of it. So first step is just a regular blood panel. We're ruling out liver and kidney problems, various things that could potentially explain it outside of the gastrointestinal tract. If that was normal, here we typically will proceed to the next step as a GI panel. We send those out to the vet school at Texas. That tests for pancreatitis, which again is very common associated with these. So it's not surprising to see a hit on the pancreatitis test. We test for exocrine pancreatic insufficiency, where the pancreas is not working properly. That's a relatively rare condition in cats. We test for small intestinal bacterial overgrowth, which is also a relatively uncommon condition in cats, but it comes with this panel. And then we're testing for a B12 level. And a B12 level is an intestinal function test. That's a really important test in this situation, because if you have an abnormal intestinal function, you know that this is a very severe situation that you really need to continue to keep drilling down onto and getting to the answer. If those things do not give us something that we can hang our hat on completely, which is very, very likely, we're going to proceed to the next test, which is an abdominal ultrasound. With the abdominal ultrasound, we're kind of doing two things. We're looking for evidence of inflammatory bowel disease, which is typically going to be a thickened intestinal tract, or at least primary bowel disease. And we're looking also, in case we don't see that, what we're scanning through the entire abdomen when we do this, we're looking for another source of the vomiting potentially somewhere else. So occasionally we'll see like a solitary intestinal tumor, or stomach mass, or a liver problem that didn't show up on blood tests, or something like that. Occasionally we'll see something there. If those things, if the abdominal ultrasound shows us that we have thickened bowels and we're still thinking inflammatory bowel disease or intestinal lymphoma at this point, we're then going to recommend and hopefully proceed to a biopsy situation. That's the only way that we can diagnose inflammatory bowel disease or intestinal lymphoma at this point in cats, and so we have to get a biopsy of the intestines. When we get a biopsy of the intestines, we're really looking for those things to show up under the microscope with the pathologist telling us this is definitively chronic inflammation. Lymphoplasmacytic enteritis is a common term that we get out of that, which is one of the different types of inflammatory bowel disease. Or we might see that it's actually intestinal lymphoma. Those treatments are very different, so it's really critical that we pin that down before we start treating. Treatment trials are very kind of messy because we're using potentially cortisone, which has its potential side effects. We really want to know that we should be doing that to warrant, us embracing those side effects, basically. And we also don't want to be treating intestinal lymphoma with cortisone only, because it's going to improve for a small amount of time, and then the kitty's going to hit the skids, and it's really difficult to get that cat back, because it's very unlikely at that point, when the cat's not doing well, because it has gone into partial remission with its intestinal lymphoma, because it will respond to prednisone for a time, but then it's going to come out of remission relatively quickly, and it's really difficult at that point, because we're not going to likely pull the cat off of cortisone and go back to do surgery, and we really need to get the biopsies before we're doing cortisone. So it's all very complicated to some extent, but straightforward also for us. We just have a process here, and this is one of the really good reasons why you want to get your cat pet insurance, because you probably have a 30% chance of every kitten that you get out there to turn into a chronic vomiter. And if you have that, you really are going to want to have your pet insurance in place, because it's going to probably cost you somewhere between $2,500, maybe $4,000 typically to do the entire workup, including surgery. It could be more than that depending on who you're using. If you're using an internist, it's probably going to be twice as much. And then you have the therapy going forward. And one additional thing that I want to point out, when we get to the point of starting to do treatment, oftentimes we do have inflammatory bowel disease or intestinal lymphoma requiring treatment with cortisone, which is going to greatly help these kitties. It's a wonderful medication for this particular scenario. The cats tolerate it very well. They don't have a lot of side effects on it, but it is a very powerful tool for this particular issue. But one thing that I just want to go back to is the chronic pancreatitis issue. So when we have chronic pancreatitis in a cat, we frequently will burn out that pancreas. And when we burn out the pancreatic tissue, again, it's chronic inflammation leading to scarring. When we scar that organ down, we no longer can produce the things that that organ is supposed to be producing, which is a gland, and it's producing insulin. And so we frequently will end up with a cat that has chronic intermittent vomiting, having inflammatory bowel disease, side dish of chronic pancreatitis. Hopefully a diagnosis is made at some point, and we start that cat on prednisone. Prednisone is going to push a little bit, doesn't create it all by itself. That's very important that you know that. It does not create it by itself, but it will promote the change to a diabetic state in a cat that is borderline with diabetes. That situation can be kind of complicated to some extent, but the vast majority of those kitties, you can't pull them off of their cortisone without them, again, reverting back to a chronic vomiting state and potential weight loss. So oftentimes we have to treat the diabetes as well. But it's pretty common to end up with a chronic vomiter that develops diabetes because of chronic pancreatitis. So take-home message here, feed your cat the right way from the very beginning. Feed them a canned grain-free diet. Get your cat pet insurance at the very beginning, so that you are financially prepared for the problems that will come with your kitty, because it is a living, breathing organism that unfortunately will die and have diseases come. Make sure that you're not blowing off the chronic vomiting. If you notice that your cat is vomiting, you should have your antennae go up, and you should be watching that cat. If you have, a couple vomiting episodes, you should consider doing a diet change right at the very beginning of that kind of process. If that doesn't halt your problem, you should go into the vet and talk to them about this. And please just make sure that you understand that it is absolutely not normal for your cat to vomit. It is a sign of disease. If you don't address that disease, it may end up being that you pay a very hefty price at the end of that process, because you have something that unwound on you and created a much bigger problem. And I hope that that doesn't happen to you, but I do want to help you all out there. This is a really common issue that a lot of our cats will be unfortunately given. And hopefully we can help you navigate through that problem and make our kitties live a long, happy, healthy life with less nausea in their world. Thanks for watching that. I hope you guys got a lot out of this. Be sure to like and comment on this so that we can see that you actually are enjoying these, and we'll do more of them.
When we got something to say, we go to where the cats play. Come hang with us for a while. We promise to make you smile. Cat Room Chats.